A very important topic. The White House Opioid Commission now gaining support from the First Lady.
I plan to use my platform as First Lady to help as many kids as I can. I look forward to working alongside the Presidential Opioid Commission and people such as yourself to do all we can to teach children the dangerous consequences of drug abuse.
Well, as the Trump administration ramps up the fight against addiction, we want to know when doctors should prescribe opioids. When are they useful and what their patients need to know? So we're asking board-certified psychiatrist and addiction specialist, Dr. Domenick Sportelli. Thank you so much for coming in early this morning.
Thank you so much for having me, Heather. Such an important topic.
Yeah, so let's talk about where you say it begins. And it begins with over-prescribing these medicines.
It did. What we saw in the late 2011, 2012, we saw sort of a decline in the prescription opiate overdoses, but it really started, the root of this problem started with over-prescribing because it put it out there in the community. Now what we're seeing is more illicit use, but it really started with the opiate prescriptions by physicians.
And we mentioned that they're trying to take some steps now to curb that, and we can show you some of the things that they're doing, working with pharmaceutical companies to find some alternatives to opioid prescriptions, develop potent but non-addictive drugs. And here's a big one: limit supplies to 7 days versus the 30 days.
Absolutely.
Do you think that will help?
Yeah, listen, they're doing great things now. I'm on the front lines of this, Heather, every day. I'm in the hospital doing detox. I'm in the ICU talking to kids waking up from a coma after an overdose. I'm dealing with patients in the outpatient services for abstinence. We need to do things, right? So what's happening now is doctors have to be held accountable. What's happening is this: when I prescribe an opiate, if I were to prescribe an opiate, I need to look up the patient's history, make sure no other physicians are prescribing opiates for this person, then prescribe with a limited amount. That puts a lot of accountability on the doctor. It puts less medicine out in the community, and it really prevents patients that are doctor shopping from getting excessive supply.
Yeah. So put more responsibility on the doctors in terms of knowing what drugs these patients may be taking, whereas now I know a lot of the pharmacies are supposed to be responsible for that, right?
True, true, absolutely.
So you personally have dealt with this, so you know what you're talking about in terms of your family.
You know, one of the reasons why I do addiction medicine and I specialize in addiction, and I really, really enjoy helping people with this horrible epidemic, is because I grew up with it. You know, I had a family member that was dealing with heroin addiction, and when I was a young child, I grew up and I saw how devastating it was to the family, literally breaking families apart. And on a personal level, I saw the suffering and the money and the rehabs and just the horrific outcomes, and I really wanted to make a difference. And now it's a wonderful thing to see people get better.
Yeah.
You know?
So what is the answer ultimately? I mean, less prescriptions, non-addictive medicine. When would someone need this? Is there a reason people would actually need these?
Well, see, that's the dilemma. That's the ethical dilemma, is right now as physicians, here's the facts. We don't have anything to treat chronic pain. That's the problem.
Okay.
Opioids have changed medicine for the better. There's no question about it. Post-surgical, you know, when you have someone that has terminal cancer, for example, they need opiates to help them lead better lives. People that have chronic pain have higher incidences of suicide, things like this. So as a physician, we're there to help. And opioids do help. Unfortunately, chronic pain is the problem.
Yeah.
So, you know, finding more interventional strategies to treat chronic pain is important, but also really limiting what we're doing with the opiates, because it's not meant to be a long-term solution.
Yeah. Well, hopefully this is a first step to solving this issue, what the government is trying to do now. Thank you so much for joining us. Appreciate it.
Great to be here.
Great
Thank you so much for having me.
All right.